Hi there, how are you doing? Alright, let's get straight to our cranial nerve exam. First, I'll take your vitals. So you breathe in and then you breathe out, as always. So breathe in. Wonderful. Now breathe out, please. Good. Wonderful. Now once again. In and out. Wonderful. And now once again, breathe in. Then breathe out. Okay, amazing. Now I will ask you to hold your breath for a moment, okay? So inhale and then hold there. Now exhale, and once again the same kind of thing. Exhale. Okay, great. Well, so that seems to be just fine. Now your reflexes, and would you please bend your legs and put one knee over the other one? Okay, great. Good. Now switch them, please. Wonderful. Good job. Okay. Now could you please follow this red tip of the hammer for me, just with your eyes? But please don't move your head. Follow it with your eyes only. Good job. Alright, amazing. That seems to be just fine. Okay, now please tell me when it leaves your field of vision, okay? Great. Good. Wonderful. Now I'll close one of your eyes and we'll do the same. Just let me know when it leaves your field of vision. Good. And now with the other one. Good job. Okay, well, you're doing great so far. Now could you please follow the light for me? Wonderful. Good. Now look at my nose and tell me if the light is close to you or far from you. Good. Now once again, please keep on looking at my nose. Don't look at the light directly. Wonderful. Okay, great. So now please have a look at this chart. Okay, so could you please read the line right below the green one? Good. Amazing. Okay, now the next one, please. Right. Wonderful. Now could you please tell me what letter is this? Okay, and what about this one? Good. What about this? And this. And what about this letter? Amazing. Good. Okay. Now please tell me what color is that? About this one. This. Good. Right, sure. And this. Okay, amazing. Now could you please concentrate on my nose once again and just tell me what color of light can you see. So it's red. Amazing. And what about this one? It's green. Okay, now could you please follow the red light for me? Yeah, now you can have a look at the light directly. It's fine. Okay, now let me know when the green light leaves your vision. Good. Right. Okay, great. So now, what color is this? And once again, could you please follow the blue light for me? And now tell me which one is closer to you, blue or red? Please look at my nose. Okay, great. Blue, wonderful. And now, okay, and now once again, great. And now, wonderful. So the red one. All right. Good job. Now, could you please look right in the center of these two circles and tell me when you can see two of them, okay? Good. And what about now? And what about now? Now. Okay, great. You're doing good. Well, now, could you please tell me when you stop hearing these humming sound and vibration right behind your ears, okay? Good, wonderful. So, if you're ready, okay, great. And what about now? Okay, wonderful. Good. Now I'll just tell you, I'll whisper a few words for you, okay? So, 21. Very good. Now, the printer. Amazing. Laptop. Good. A candle. Body lotion. Sunscreen. Okay, wonderful. Great. So, you're doing so good. Okay, and now your olfactory nerve. Could you please take a smell? Does it smell like to you? Green apple. Wonderful. Good. And what about this one? Okay, give me a moment. I'll open it. Okay, what about now? Some kind of spices. What exactly? Cinnamon. Good job. And now more. Okay. Can you smell anything? Lilac. Right, you are. Good. Alright, well, and now the taste of, well, actually the sense of taste. Ready? Okay, so what is that? It's just like salty flavor. Good. And now the other one. Stick out your tongue for a moment. Good. So sour, something like lemon or lime. Wonderful. Good. And now, could you please straighten both of your arms? Close your eyes and reach your nose with your index finger. Good. And now with the other hand. Wonderful. Well, I'll see you soon. Have a good one. Bye. Well, hi there. Welcome to your hearing test, your hearing exam. Well, whatever you call it, tonight we're gonna check your hearing. And can I touch your ears first? Okay. Wonderful. So before I do that, I'm gonna put on my gloves, if you don't mind, of course. Awesome. How are you doing? Have you had any complaints regarding your hearing lately? Okay. Seriously? Oh, that's kind of crazy. Well, give me a second. Is it alright if I touch your ear right there? Alright, I'll use some light to have a look at your hearing canal, at your ear canal. Okay, so, well, looks good to me. There's nothing special there. And what about the other one? Alright, looks just fine. So have you ever had any kind of wax buildups in your ears? No, it's fine. Okay, great. So now I'll use the tuning fork, and I bet you know how it works, so I'll put it right behind your ears, okay? Good. So let's get a start. Just let me know when you stop hearing this kind of humming sound and the vibration, okay? Okay, Right, and now the other one. All right, great. And now I'll put it right on top of your head, okay? Good. Just let me know when you cannot hear the sound anymore. Okay, wonderful. Now please let me know if the sound, like the pitch on the sound and how loud it is, if it's quite the same to the previous one, or maybe it's louder, quieter, maybe like the pitch is different. Yeah, it can be like higher, lower, and so on. Okay, so let's do it. So we'll experiment with different tuning forks, right? Good. So have you noticed any difference? Let's try with the other one. Okay. Good. So once again, anything? Okay. Is it any different from the previous sounds? Good. Alright, so now please close your eyes and let me know if you can hear the sounds with the latex glove or without it, okay? So, are you ready? Good. So it was my hand in latex glove. Okay, now keep your eyes closed, please. So that was the one without the glove. Okay, great. Now once again. Okay, the glove. And what about now? Good, so that was my hand, like without one. Okay, great. Now please let me know the direction of the sound, okay? So just where it comes from, either the left side or the right. Good. Wonderful. Okay, great. And what about now? And now once again. Okay, good. Now please keep your eyes closed and just let me know when the sound changes the direction. So no need to mention, no need to tell which side it is exactly. Just tell me when you feel the switch in the direction of sound, okay? Okay, good. So let's do it. Good. Once again, wonderful. Great. And now two. Okay, wow. Good. So it seems like your hearing is totally fine. Well, I'll see you later. Bye. Oh, hello. Welcome to your eye exam. How are you doing today? Can I have a closer look at your eyes? Wonderful. How does it feel when I touch this area around your eyes? Is it alright? Are you sure? Wow, great. Let's start with the Snellen chart. So, could you please read this line, the second from the top? Sure, you can do it. Wonderful. Okay, what about now? Could you please read the one that is right above the red line? Okay, good. Good, doing great. Wonderful. Exactly. And now let's read the last but one. Good. Good. All right. Awesome. Well, now I have another chart for you. It's not exactly a Snellen chart, but quite similar. It also has letters on it. So could you please tell me what letter is it? Okay, good. And what color is it? Wonderful, great. Now what about this letter? And what color? Okay, great, good. So now what about this letter? And what about the color? Is it the same like this line? Are they exactly the same? Are you sure? I bring them closer to you. Can you see any difference in shade between these two lines? Okay, wonderful. Now what about this letter? Okay, and now this one over here. Wonderful. And now what about this one? Great. And finally this. Wonderful. So can you see two lines of exactly the same color, exactly the same shade of color? Are you sure? Okay. Wonderful. Wow, great. So I can see that you are not colorblind, but I'd like to explore it more. So now could you please tell me what color is it? Good. What about this one? Obviously it's green. Now this. Alright. And what about this? Can you see difference between these two cards? Okay, are you sure? Okay, well, wonderful. And now, could you please tell me what can you see here? Alright, exactly. And now, please tell me, what about this card? Does it have anything in common with the previous one? So the shade of color, like these two, are quite similar. Okay, what about the shapes? This is diamond and this is a triangle. All right, great. Now could you please look closer at this diamond? So is the color all the same all over this card? So it's slightly different. So where can you see the darker shade? Is it on top or closer to the bottom? Wonderful, good. And now could you please tell me if you can see anything inside this circle? What color is this circle, by the way? And what about this shape inside it? What is it? Letter P. Okay, what color is it? Something like yellowish, orangish. Okay, great. And now, can you see anything here on this circle? All right, are you sure? Interesting. Now, please tell me, can you see anything here inside this circle? Are you sure? Okay, and what about this one? So you can see letter L. Wow, how interesting. Good. You're doing great so far. All right, well, now could you please tell me what color is it? Yeah. Okay, let's do it once again. Good. And what about this light? Okay, so this one is green and this one is red. Could you follow the green light for me? Good job. And now please tell me how many times you can see this green light appear in your vision, okay? So how many? 3 times. Okay, what about now? And now let me know which direction it comes from, okay? From the bottom, from the top. Okay. Good job. And now from the other side. Okay, wonderful. Let me have a closer look at your pupils. Okay, great. And now the other eye. Wonderful. Could you please tell me when you can see my fingers wiggle, but concentrate on my nose, please, okay? Good. Good job. Now please tell me when my fingers disappear from your vision completely, from your field of vision, okay? Good. Okay. Wow, you're doing good. Now, please tell me. So, can you see any difference between these two lights? So this one is white, cold, and this one is warmer. What about the size? So this one is a bit bigger, yeah? Okay, good. So now, could you please tell me when this smaller yellowish light leaves your vision, okay? So when it disappears. Good job. Wonderful. Okay, amazing. So both lights have disappeared from your vision. Okay, great. Now please look at my nose. And tell me when the light starts like flashing, okay? But look at my nose. Good. Good job. Now let's do it once again, just on the other side, but please keep on looking at my nose. So can you see the light? With your peripheral vision. Good. Okay, great. So now let's test your oculomotor nerve. So could you please look at number 6 for me? 2, 8, 4, 7, 3, 1, 5, 6, 2, 4, 8, 7, 3, 8, 4, 7, 1, 8. Okay, great. Well, I could see the eye movements, and yeah, everything is just fine. So, and now when it comes to testing your vision, I'd like to test your both eyes separately. So I'll use this thing to cover one of your eyes. Now please tell me when my fingers disappear from your vision. Good. Wonderful. Now how many fingers am I holding up? Okay, great. What about now? And now. Good job. Okay, now tell me when my fingers disappear from your vision, okay? Am I blurred? No, it's fine. Great. Great. And what about now? How many fingers can you see? Okay, now. Good job. Good. Wow. You're doing great. So I'll see you a bit later and have a good one. Bye. Oh, hi there. So you're here for your skin checkup, right? Wow, that sounds great. Can I have a closer look at you, please? All right. Does it hurt if I touch your skin right here around your cheekbones? I can see a little bit of redness there. Alright, well, can I use the light to explore it in a little bit more detail? Okay, good. Wow, overall your skin looks just great. I don't see any traces of acne or other stuff, but this redness, wow, what do you think? What could it be caused with? Do you have any idea? Have you been allergic to anything lately? Alright, okay. Have you had any kind of irritation on your skin? Okay, well, so let me check it with some of my tools. Give me a moment. Well, you know, I will just have a closer look at these red spots on your skin, and I might take a little sample of your skin for further check, for further investigation, if you don't mind, of course. Okay, so I'll take a few tools. They might look a bit scary, but no worries, it's all fine. I'm not gonna hurt you, so it's gonna be all right. Okay, good. So let's do it this way. I will just have a close look at your skin right here, and now let me get this sample with the tiny bit of your skin. So tiny flakes of your skin in those places with this redness, because I could also spot some dryness there, and in general, as far as I can see, you have normal type of skin but closer to dry one, right? So, and I suppose your skin is really sensitive, right? Okay, well, yeah, I could see that. And what kind of skin care routine do you have, may I ask? Okay, so when your skin is inclined to this dryness, you really have to moisturize it well. So it's one of the most important things you gotta do, and one of the best things you actually can do for your skin, you know, like to help it feel better. So I would recommend you some really nice kind of like skincare products to take care of this dry skin. I'm not talking about the exact brands right now, so it's not some kind of, you know, advertisement. No, it's just like I will show you how it works and you'll be able to choose whatever works best for you. Okay, so we'll compare a few different products. Can we just appreciate this nice fragrance for a moment, right? So it smells divine. Okay, so apply some of these moisturizing cream onto your skin, right? And then onto the other side, we'll just try something a bit different. Okay, and while I'm doing so, can I also ask you, what about the SPF? Have you been using any? Because you know, in this summertime, it is especially like particularly vital. But basically, you've got to use it anytime you go out, even when the weather is not super sunny. Still, yeah. So in order to avoid these kind of aging that the ultraviolet rays can bring to your skin and stuff like that. So all right, and now I have a bit different cream, so it's kind of like even more nutritious, even more rich in its contents. So it has some shea butter and some avocado oil and something else, I believe some more oils, right? So it's just a bit more like oily but at the same time it's really good, so you can apply it as a kind of like night cream. So give me a moment. I will just apply some onto your skin, but on the other side, so that you can really, you know, test how it works for you. Okay, good. Well, and besides that, so it's kind of like a bit too late to do that, but before your cream you can also use this serum, so it will actually help to moisturize your skin as well, right? I will just apply a tiny amount onto your hand so you can just see what effect it does. And then basically, so your skincare routine, you can use some kind of cleanser, like it can be either foam or gel. Then afterwards, it's really good to use the moisturizing toner. Then afterwards, you can use this kind of serum or any other one working for you, and only then you're supposed to apply the cream, right? So regarding SPF, so there can be something like this or some other ones. So you know, there are a lot of these neat like boxes with these beautiful tubes or bottles with these creams. It's just like some of these SPFs can have a really thick texture, and usually they would be of this really like white color, and some of them can be rather wet, having this thinner texture, and like actually having this maybe a bit more like moisturizing effect, right, on your skin. So you can choose whatever works best for you, but just please don't forget to use it, to apply it, because it's really important for your skin. Well, and then let me have another look at your neck and chin, this area. Have you had any complaints related to either of these areas? What about the rest of your body? Have you been using any kind of like body lotions to moisturize your skin after showering and stuff? Okay, great. So you know everything, so I'm pretty sure that we'll deal with this trainers using any of these kind of like skincare products, and in case if it's not enough, then we'll see the results of our tests of these like your skin samples, and just in case there's something disturbing there, we'll let you know. Okay, so we'll contact you right away. Great, see you soon, bye. Oh, hi there, how are you doing? Do you have any complaints related to your teeth or gingiva? Okay, seriously. Alright, well, let me have a look at that. So I got my mirror and I got the light. So let me have a closer look. Could you please open your mouth widely? Good job. Wonderful. Great. Well, now to chin up a little bit. I need to see your upper teeth. Okay, amazing. Wow, so what can I say? It's not that bad, but there are still some things we could improve. I could see the tiny spots here and there, so we could cleanse that. And I suppose that you might need a fill-in in one of your teeth. Okay, well, would it be all right? Do you have insurance, by the way? Are you sure? Okay. Well, anyway, talking about your teeth. So, do you think you brush them quite frequently enough? Are you sure? Because it seems like all these things related to these spots on your teeth, they are usually caused by like the lack of proper brushing, proper cleaning. So let me have a look with this brush, okay, if you don't mind, of course. Very good. So okay, now on the other side. Good. Now open your like mouth, please. Yeah, just as wide as you can. Okay, well, good. So now it seems like so much better than it used to be. All right. Well, now you can also rinse your mouth every time after you clean your teeth, after you brush them. Okay, so you can use solution like this or any other kind. So could you please open your mouth? I'll put some into your mouth, but just be careful. So you have to rinse it and then spit it out. Right there. Yes. Oh, careful. Good. So, but first you have to brush them really well, so really thoroughly. Okay, so then the other one, I will put a little bit of this kind of stuff onto your teeth, the one that we need to fill in. So keep your mouth open, okay, please. So just a little bit there. Okay, well, let's give some time to soak in, and now I will show you what kind of rinser you can use for your teeth. So just give me a moment, and it's really essential that you use it at least a few times a week, okay? So at least once a week. That will be better than nothing, definitely better than nothing. Okay, I'll pour a little bit onto this glass. Okay, so you please try it. So I believe that substance has already dried up on your tooth. Okay, and now we are ready to like make this filling for you. Okay, so I'll use some kind of substance, so we have the best fillings ever. It will last for as long as possible, and it will be this like perfect color, which is exactly the same as your teeth, so nobody will see it. Okay, well, so a moment. So okay, keep your mouth open, please don't close it. Okay, wonderful, great. Okay, so how does it feel so far? So let's wait a few moments, and while we are waiting, I can see something on that side, so I will try to clean it up there, okay? But you really have to brush your teeth more thoroughly. So all right, so let's do it this way. Okay, good. How does it feel? Okay, and now on that side too. Okay, well, good. So, well, I suppose that the filling is ready, so let me have a look at it. Great. So now you can close your mouth. How does it feel? Okay, good. Well, so I'll see you later. Yeah. Have a good one. Bye.